Wow, good morning. This is Dialogue Box. We trust that you had a wonderful weekend, and we know that several things are still, unfolding, and we are so thankful for the events as they come up. And one of it is the fact that doctors have already called off, that's the National Association of Resident Doctors of Nigeria, have called off the strike that they embarked on a week ago. And that is a major a major congratulations to that sector, saying thank you so much for yielding to the pressure from the different pressure groups, even the federal government trying to appeal to them to say that they will meet their demands, but it will be at a gradual state. It's not something that they will just meet everything at once, and they have also accepted the fact that in 4 weeks' time they will review their decision. But we know that they will not embark on another strike, and at the same time we are asking the federal government to ensure that their demands are being met and there's no relapse. Wow. Now we have a mandate to work towards a healthier Nigeria, a healthier COVID-19 free Nigeria, and that is what we are embarking on with very, very strong force. And with that, we are also working towards ensuring that all our institutions are free from more news of COVID-19 rising and maybe deaths. We can talk about it, and the fact that in some states they are still having to kind of try to cope with that challenge in however they can look at it, but it's been very, very difficult for some of them. We have some commendation here for, first of all, the Shell company, that's the Shell oil company, has also given their support to the Lagos state government for the treatment of COVID-19 patients. And for that, we say a big thank you. They are donating some equipment for the blood checks and several other means of verifying their treatment processes. And also, we are commending even the Lagos state, though is the epicenter for the COVID-19 pandemic, sorry for that, has also been doing a lot to ensure that everything is on ground to bring about a COVID-19 free Lagos state. And for that, since we are talking about working towards a healthier COVID-19 free Nigeria, we would like to take an aspect of how much they have gone from the Nigerian Center for Disease Control, NCDC. They have announced that 436 new cases of COVID-19 has been added to the figure they had, bringing the total number of confirmed cases in the country to 20,244. And they have 12 deaths that have been recorded from the virus on Sunday, bringing the total number of confirmed deaths to 518. Then they also have different areas where they said that new cases have been reported in 19 states, including Lagos State, or your state, Plateau State, Imo, Kaduna, just name it, Ogun State, the Federal Capital Territory, FCT, and some others. And all these cases that are on the rise, they had it at least one infected patient of the virus has been in such state. It's only one state that has not reported it, and that is the Cross River State. So the NCDC is attributing the increase in the number of confirmed cases in the country to increase in the number of testing centers. So they are saying that the reason why there's a rise in the number of states, or rather in the number of patients that they have for the COVID-19 case across the country right now, is because the testing centers are also on the increase. So but we are wondering why. What's the connection between the number of test centers to the higher number of disease cases or symptoms that they are currently coping with? So does it mean that more testing centers should go round all the country for us to have a healthier system or a healthier state? Or it is just to let us know that more orientation needs to be done, maybe from the state level, the federal government level? They gave an instance in Kaduna State. They said that the increase in testing centers in Kaduna State also gave rise to the increase in those that they have discovered to be carriers of the COVID-19 disease. And so to that, they said because he collaborated with also the African Center for Disease Control, and they're also saying that the local government, but most of that is a GIWA local government, that's the GIWA LCDA. So the agency is saying that improving testing or giving more access to testing centers in Nigeria will also enable them to tackle the challenge more and to have more of treatment cases. So the fact is that we are working towards a COVID-19 free Nigeria and giving rise to areas where, like we said last week, we don't want economy to be affected negatively, and we don't want any sector to go down because of the COVID-19 pandemic. So while we are trying to achieve that, we commended the doctors for calling off the strike. But the angle that the NCDC is bringing up right now is the fact that if they have more testing centers, then definitely they will kind of maybe diagnose more cases of COVID-19 patients, or those who did not know they had the COVID-19 pandemic, and now they are now aware because a testing center has come to their locality. So, but with this, and even with the NCDC agitating or asking for more testing centers, what more can be done by the federal government and the different government levels and even individuals to see to it that there is a safer society on the general basis for Nigerians at this, because we have a lot at stake. Several things are going on at the same time. COVID-19 should not be the distraction here. We also have the government trying on its own on the financial scale to release more. They said they've given $58 million. That's over 21 billion naira for the treatment of the pandemic and the building of more isolation centers. But how do we ensure that we have a safer Nigeria, a healthier Nigeria, a COVID-19 free Nigeria? You can send us your opinions, your thoughts, and your comments, and let's work towards improving on the general safer society, as we are calling it right now. What is your thought? How do you think we can go about this? Does it mean testing centers should spring up everywhere? And if it does, rather, does it mean that maybe more people are carriers of COVID-19? So, but the other aspects are the areas of the health sector saying that not everybody who is testing positive for COVID-19 is maybe on a scale of maybe emergency case, or somebody who has a very strong aspect of maybe coping, trying to struggle between life and death. No, that most people are also recovering and they are going back home. And as a nation, what they have as a confirmed number of deaths from the virus is 518. So, but what more can be done to ensure that we have a safer system? You can send in your comments now, and while we are doing that, we also would like to have a live interview with Barrister Prince Uzemi Olumuagbodo to share his own opinion about the ongoing situation. So we'll get a call from Barrister Uzemi soon, Prince Uzemi Olumuagbodo, to talk to us and give us more insight into what he thinks the government should do, or individuals, name it, any sector should do to contribute their own quota to fighting the COVID-19 pandemic. Thank you so much. So I'm waiting for your comments, waiting to hear from you, waiting for your opinions, and at the same time getting you to be a part of this. Let's talk, let's chat, and work towards a better Nigeria. Do we have Barrister Prince on the line now? Barrister Prince on the line? Okay, while that is trying to come up, as we said earlier, we're also looking at some aspects of what we talked about last week, and In line with this, we also commended the federal government, though the government on the security sector said they needed more response from the service chiefs. We would like to commend the military in that regard, especially for the Air Force, because the report getting to us says that air raids against terrorists increased so much. So there was a very strong military onslaught against terrorists in the northern part of Nigeria, and for that we say a big well done to the military. So while we are doing that, let's have it in mind that we are working towards a better Nigeria, and we believe that everyone can contribute their quota to a better society. So give us your thoughts and your comment for what you think the government needs to do to reduce even the number of cases we have. Right now, talking about over 20,000 confirmed cases of those with the COVID-19 virus is not good enough. And NCDC telling us that more testing centers should lead to more cases of those with the COVID-19 is also not good enough. So what should be done for the general education of the public and a kind of a reorientation for everybody to know? Because some people wear masks almost all day long, and at the end of it all, we are still hearing that the COVID-19 patients are not reducing. So what is the case? What is the issue? And what more should be done? All right, we have a comment here from Grace Mercy. She said, "Good morning, Ma. I'm glad the doctors have made the best decision." Thank you so much, Mercy, for that. That's a very good one, that the doctors have made the best decision. Because why? Like we said last week, it's all about saving lives. Even though you're trying to press for your allowances and arrears and salaries, but at the same time, we're also looking at the fact that you are there to save lives and to help prevent several deaths. So that's what Mercy has already said. Now we are asking you to talk about what more can the government do to reduce the number of COVID-19 patients. Is it by opening more testing centers? Is that what is going to give into a safer society, a safer or a COVID-19 free society? What more can the government do at this point in time to ensure that definitely they are ridding the society of COVID-19, and COVID-19 should not be a factor to put the country to put the country in a state of maybe like confusion, talking about health, the complications that will come with it. What more should the government do, individuals, the corporate sector do to reduce the number of the COVID-19 cases we are having? And even with the testing centers, should it lead to increase or reduction in those who are said to be carriers of the virus? What more should be done? So we have a call that will be coming in, like we said, Barrister Prince Olomuagbodo. So we are waiting for that call. Once it comes in, we'll take it and we'll hear it together. So send in your thoughts, send in your comments, and let's talk about how to improve on the society as we have it right now. We want a healthier Nigeria, we want a safer Nigeria, and we want a COVID-19 free Nigeria. We don't want COVID-19 to be a part of our livelihood, and it shouldn't be something that will be there for all time. No, whatever it is, let everything be done to ensure that COVID-19 is dealt with decisively, and we are not given to any pressure from that health demand. All that needs to be done should be done now. So NCDC's analysis or statistics or whatever it is, we should also work towards ensuring that we reduce it, we bring it down, and there should be no selfish interest from any area to bring about higher cases of COVID-19 infection. No, we shouldn't have that right now. So whatever be the case, send in your thoughts, send in your comments, and let's talk about this together. What can be done by the government, the private sector, and the corporate sector to bring about a safer society? All right, a call. Is a call on? Okay, why this is what being worked out, talking about bringing in a call that can also help us see the person that is calling. What is your thought? Like I asked you earlier, is the solution by setting up more test centers around the country, or should more be done to give a proper orientation to the people to see to it that everything that has to do with COVID-19 is dealt with decisively, and all that needs to be done to ensure a safer society is also achieved? We don't want a situation whereby more and more cases of COVID-19 patients are springing up. So does it mean enough is not being done to achieve some form of relief for that? And whatever it is, or however it's happening out there, what more should be done to ensure a safer society? We have a comment here from Savior Nduka. He says, "Good morning, Blossom Nigeria. The government should use social media and apps to spread accurate information, and they should create more testing centers." So, but NCDC is also saying that testing centers are leading to more cases that are being discovered. So how can even some of these cases subside even in their homes without having to come to the testing center first before noticing that there was an issue? And don't forget, some of these symptoms are maybe like we have cases of maybe high temperature or some other symptoms, and they will say that these ones are prone to COVID-19, and some of them can even be separated into isolation centers as COVID-19 positive patients. But the fact is that, will you put somebody who is having symptoms of malaria or very high temperature for COVID-19 treatment center because of some of those symptoms? So we have to be very accurate, like Xavier said, so that accurate information can be spread, and not just about creating testing centers. Even that is a very good step, but then however it is, how they are going about it must lead to the reduction, not to the increase in the number of those that are being infected by COVID-19 in Nigeria. It shouldn't get to a point whereby it's as if the more hospitals you are building, the more cases of infection, the more patients, and even like so some people might even tell you that don't bring hospital again, because the more hospital you are building, the patients are increasing, it's not reducing. But we know that the essence of the test centers and the hospitals is for the treatment. That means to contain the virus. So containing the virus should also lead to the reduction in the number of those that are infected and in the number of those who have maybe yielded to some form of maybe death or something. No, it shouldn't be so. So government should give us some more assurance that giving test centers and building test centers should lead to reduction in the cases of those who are being infected by the COVID-19 virus. Do we have our call now? Is our call ready now? Okay. So while that is coming on, we have Savior Nduka's comments to also, like I said, let's look at it very well. Accurate information, very, very key. I think I like that word, accurate information. So are we ready now for a very, very strong course? We don't want just maybe like some people will say political cases or causes. No, whatever needs to be done to ensure that all attention is being given to containing the COVID-19 virus in Nigeria. Do we have the call now? Okay, so while this is still going on, send us your thoughts, send us your comments and your opinions, and let's see this together. We have from Grace Mercy Emmanuel saying we should, instead of creating more test centers, create a cure. Okay, I think the comment is still unfolding. So in other words, just like what we said last week, we should invest more on having centers for curing COVID-19. So we looked at an area where the president was saying that there should be knowledge sharing and more maybe innovation from the international community. And I think somebody asked a question that instead of just asking for knowledge sharing, why not in Nigeria they set up their own centers for creating a cure. And we said yes. Now that should be a very good stance, because if we work out our own solution, our own cure, just like we said we had that Madagascar did, we should be able to talk about containing this virus on a higher scale, not just by setting up more test centers, but by also having, let's call them solution centers. So can't we have solution centers? Can't Nigeria come up with a cure? And even some people propose, like we did last week in our program, that herbal supplements and some other herbs can even be a part of curing the so-called, or curing the COVID-19 virus. So if this is so, how much more should the government do to ensure that the fact is not just about setting up test centers, but using that same energy, using that same passion to also create solution centers, treatment centers with the right treatment solutions. So this is what we are working on right now. A call is coming in. Can we go? Just a second. That one? Okay. Okay. Sorry about that. There was I thought a call was already coming in. All right. So she is also, Grace Emmanuel continued by saying that I have seen a couple of Nigerians share their research work as to providing the cure for the pandemic. The federal government should fund these people. We have wasted a lot of money in detecting, just a second. We have wasted a lot of money in detecting the cause. Let's start working on the solution. And that is it. Instead of just setting up a means of detecting the cause, which we have already done to a large extent, why not put that same energy on working out a solution, detecting a solution for whatever the problem that has been discovered is. So the COVID-19 as it is right now, it is not something that one country will just lay hold on and say, okay, my cases are rising. It's not something to be proud of. It's something that every country should put in the adequate attention to see to it that all that needs to be done should be done to reduce the number of patients, and also to give more attention to areas that can aid cure solutions, and also give more to the supplements that are needed, the drugs or whatever that are needed in the health sector. So that's what we are saying right now is very, very key. We can set up test centers. Nobody says you shouldn't. But don't say because you are setting up more test centers, so the cases automatically are increasing. So what are we now doing to ensure that the cases are reducing, even now that people are, let me use the word, at home? So now that they are at home, what are you doing to ensure that there will be no more symptoms and the symptoms are reducing, instead of asking for more test centers for more cases to be discovered? So our call, is it ready now? Okay, so we still get more of your thoughts, more of your comments. Just like we have said, Savior said we should be giving, government should give accurate information, and Mercy is saying that the cure for the pandemic is not just about setting up test centers, but that it should be about working out a solution. So don't you think that should be the angle that the government should be looking at it from? Working out a solution. Because at this point in time, it's a matter of life and death, and everybody is looking at how to save their lives and preserve and protect what belongs to them. So it's not enough for government to just say wear face or nose mask. Some people, like I said, have been wearing it all day and they are still having to deal with such. So let's give it more attention and work towards a safer Nigeria. We want a healthier Nigeria, a safer Nigeria, a COVID-19 free Nigeria, because we don't want distractions from this sector. And we don't want a situation whereby people will say because of COVID-19, this and that did not work. All right. We want your comment. We have from Coco here. She says, good morning, Blossom Nigeria. I feel the government have to learn from other countries, such as Israel, by conducting technological research and come up with technological inventions the app, maybe the app is one of the ways of detecting a form of a cure. So what Coco is proposing is that just like Israel is doing by conducting technological research and coming up with such inventions, Nigeria should do the same, and that Nigeria has a resource to do the same. Then we have Francis Chukwu here sharing with us, or adding his opinion. He says, I think NCDC should train more personnel and allow some equipped hospitals to handle these cases. NCDC cannot do it alone. So in other words, NCDC should collaborate more with more hospitals and work out a very, very good way of coping with this challenge. We don't want a situation whereby they say because NCDC was unable to cope, so because of that it led to this or that. So whatever be the case, Nigeria has what it takes to handle this challenge. We have Barrister Prince Zeme that we've been trying to get to be on phone. I'm seeing a comment from him here. He said, good point. I have sent a request to join. Okay, let's see. All right. Good morning, Barrister.
Good morning, Blossom Nigeria.
How are we doing?
Very fine, awesome.
Okay, we have been talking about the NCDC giving us statistics that there is increase in COVID-19 cases, because we know that according to them, they said it's because of more test centers that is set up in Kaduna State. And because of that, more cases of COVID-19 are coming up by the day. So our question is, should the government focus more attention on test centers, which according to them should lead to more cases of COVID-19, or it should work on solution and bringing about aspects of solving this ongoing challenge?
Yeah, I think the government's approach should be two-pronged. Two-pronged in the sense that it should do what it's currently doing, as in get more test centers, get more people tested and all of that. Yes, more people being tested would naturally give rise to more cases.
Okay.
What that means is that it's not the test that is bringing about the cases. The
Okay.
cases are already there, but the tests are only helping to discover the cases that are already out there. So I think the government should step up its testing procedures. Then, on the other hand, the government also needs to get more transparent with the people. I believe that the government needs to, for example, the government has stated that the bed spaces are getting exhausted and people would need to be treated from home. The question that everybody is asking is that for those who are to be treated from home, what is the treatment regimen? As in, what is the treatment for those that won't be able to get to the test centers? Okay. We know that the NCDC is not able to answer everybody at the moment, and except cases that are very urgent, they are being treated from home. What drugs are being used? As in, the government has said that they don't want to disclose the drugs because it will lead to abuse, but I don't believe so. Malaria drugs are known worldwide. Headache drugs are known worldwide. It doesn't necessarily lead to abuse. So you don't want a case where you are throwing out the baby with the bathwater. So in essence, what I am saying is that the government needs to maintain or to step up its approach, get more test centers, get more testing done to discover more of the community transmission and more of the COVID-19 cases out there, and also be more transparent with the people. COVID-19 is not a secret society, it's not a secret court that everything has to be secret. It's an illness, or it's a virus that is afflicting some persons, and the government needs to be more transparent with its dealing with the people.
Exactly. Okay, finally, we have this, let me use the word, like an allegation against the government that since Madagascar discovered a cure, that Nigeria has not given the same level of attention to working towards having its own cure for the COVID-19. So it's like they are more comfortable discovering cases than having to put that same energy on working out a cure. What is your opinion on this?
Yes, I seem to tilt towards that opinion because I believe that the government should take an empirical and an evidence-based approach to this whole situation. You've gotten these drugs, these liquids, whatever they are, from Madagascar. By now, I expect that the NAFDAC and other pharmaceutical based agencies in Nigeria should have dissected and gone through whatever they got from Madagascar to tell us the active properties that are in that drug or whatever it is that Madagascar calls it. Apart from that, our local solutions, like a lot of people talk about ginger, a lot of people talk about bitter cola, black seeds, and all these local things. I want a situation where we do not realize, uh, we do not rest on hearsay, a situation where the government can say that, yes, we conducted the tests on ginger, we conducted tests on garlic and all of that to check their efficacy on COVID-19. Up to this moment, we have not been able to see even one result or one test result that the government was able to tell us that this is what we have done. So what we are saying, or what I am saying, is that the government needs to take an empirical approach to this problem. Let's not have a situation where every evening you roll out new cases only without also showing evidence that you are doing this much to see how to manage or curtail the illness. So if we have, for example, dogoyaro leaves around, tell us that on so and so date we were able to carry out the test with these dogoyaro leaves, and we discovered that the leaves were either not efficacious against the disease, or we discovered that it reduced the mortality or by so percent. That is what we want to hear. That is what we want to hear from the government.
Okay. All right. Thank you so much, Barrister Prince. We look forward to having you with us again. But that's a very, very strong one. So we are asking the government at this time, like you said, to take a very strong stance and to give us empirical
what we are sorry, but what we are saying is that let's have a fact-based discussion, a discussion based on verifiable facts. Let the government tell us that this is what we have discovered. This is what our research has shown us. But so far, the government has been silent on whatever research is carrying out. If there is any research ongoing, we don't know yet. The government needs, one, to be more transparent with the people. Two,
do you see
an empirical and research-based, fact-based approach to this whole problem. Let us know exactly what you are doing and where we stand with that virus.
Okay, do you see any influence from the international community as contributing to the areas we just stated right now? Like we have You said? You said what?
You are breaking up a bit. I said
Okay, maybe we'll take it here and we will give our viewers a very strong point based on what you said. And thank you so much for joining us. By tomorrow, I'm sure we'll get more updates on this and we can give them more details concerning this. Thank you so much for being a part of this program. We appreciate your coming. Thank you so much.
Yes, thank you.
All right.
Yes, thank you.
Okay, that was Mr. Prince Uzeme that was just talking with us a few seconds ago, and he has maintained a very and tell us how far they have gone. And it's not, even though he supported the test centers being set up, which he said will naturally lead to more cases being discovered, but at the same time they should also do the needful in telling us what has been done to ensure that there's some form of solution, some form of cure, and everything that is in everything that should be involved, maybe using leaves or some form of natural supplement, whatever it is that they are doing, they should let us know or let the people know so that more can be given to that and the people can respond more positively from the communities even to the cities. All right, this is our talk on Dialogue Box on Blossom Nigeria this morning. So we also have some more comments coming in. We have some comments here saying good points from our Barrister Prince. Then Savion Duka said, wow, Barrister Uzeme, you are highly welcome. Nice point, sir. That is from Coco. Grace Emmanuel said, valid points. Thank you, sir. And SG Ben said, wow, dialogue box getting more interesting by the day. Thank you so much for your comments. And we know that it's getting better. So this is a takeoff point for us. So dialogue box, like SG Ben said, is getting more interesting by the day. And our aim is to work towards a better Nigeria, a healthier Nigeria, a stronger Nigeria. And for everyone out there, I believe we all want a COVID-19 free Nigeria. So with that, we don't want anything that maybe a sector not performing well because of COVID-19, or another sector that literally is out, maybe weak and not able to meet up with its demands because of COVID-19. So everyone should do what they are supposed to do, and every sector should be vitally active to ensure that we as a country are standing strong even in a time like this. Tomorrow we'll be here by 10 a.m. and thank you so much for being with us today. We appreciate it.